What is endometriosis?
It affects you economically, mentally, emotionally. There's a dirty, hidden association with period blood.
This is the only blood that's not being spilled. We're so comfortable seeing all these images of children dying and bodies mutilated on the media. And it's so normal to broadcast that. This is the only blood which is like a natural consequence of having an ovary.
This is something that I didn't choose as a woman. This is a natural occurrence. How can that make you feel eerie and uncomfortable? How do I get someone to understand what I'm feeling? It took me 19 years before I was able to get an official diagnosis.
19 years. Wow, that's a lifetime. This is the first time I'm actually recording a podcast with an actress. So like I said, I think I'm a bit smitten.
I think we're gonna have a good time.
Thank you for being here.
Thank you for having me.
How do you normally introduce yourself?
So I would introduce myself as an actor, producer, and endo advocate.
And you live in the UK.
Yes, I do.
Yes. And there's a lot of things you talk about on your social media, and there's a lot of work you've done. You've done a lot of acting. But I feel like what really stuck out for me is that you're an endo advocate. What is endometriosis?
Endometriosis is a gynecological condition that affects 1 in 10 women worldwide. And what happens is that the lining that resembles the uterus starts to grow in other areas of the body. And so what happens here is that you have these adhesions that are essentially just feeding in those areas that they're on, and they feed on estrogen and are very inflammatory. And so they cause an intense amount of pain and symptoms that women experience, from heavy periods to, say, a lot of inflammation and excruciating pain. I'm talking the kind of pain that prevents an individual from functioning and doing basic day-to-day activities, from walking or standing up straight or being able to go to work. And because this condition is not as well researched, not as well spoken about, you have a number of women who are suffering from pain that they cannot explain. In my case, it took me 19 years before I was able to get an official diagnosis, because endometriosis is something that is often misdiagnosed within the medical space, again, because there isn't a lot of research and enough people aren't speaking about it. And so it's just something that makes it extremely difficult for you to be sociable, it affects you economically, mentally, emotionally, and it's happening way too often for a number of women.
19 years.
Yeah.
The first time you told me that, I was like, wow, that's a lifetime. Why do you
It's a
think
lifetime.
why do you think it took that long?
I think because, one, nobody knew what to look out for. I would say that when I started my period when I was 12 years old, and I would always remember that my periods were very heavy. I'd often bleed for an average about 7 days, and they would be heavy periods. And so when I first got my period, I remember I was in year 11 at the time, so I was 12, and we just had this sex education workshop at school. Thinking back at it now, I'm super grateful for, because we had these people come in and talk about, reproductive systems and what to look out for in your body and puberty. And then they gave us these little takeaway packs that had miniature tampons and miniature pads in them. And so that was my first time knowing what a pad was, or what a tampon was. And so when I started my period, that's what I ended up using, is those little pads that they had, showed us how to use at school. And I just never understood why I was having this kind of pain. I thought that everybody had the pain. I'd speak to some of my friends who were like, oh yeah, they get their periods for 24 hours or 2 or 3 days. And I was like, mine is 7 days. Am I that special that it has to be 7 days and it has to be that painful? And I remember oftentimes going to the GP with my mom and trying to explain to them what was going on. And they were like, this is normal. This is all part of the process. And hey, give her some ibuprofen or paracetamol. And none of that worked for me. I would be literally crawling on the floor in fetal position, unable to eat. I would be throwing up these medications that they would give me. They would then try and give me something stronger, and that didn't work, or it would work for maybe a couple of days, and then my body's just like, yeah, we're over this, we're too used to this, so we need something a bit stronger. And ultimately, I just think it was, I don't think the medical practitioners at the time, one, were, I don't want to say taught to look for it, because people would have been aware. But I think when it comes to certain women's issues, you just kind of tick the list of the basics. So the basics, is it fibroids or is it IBS? Or, but digging deeper, and then not kind of throwing away these symptoms that women are telling you they're going through. And then also as a Black woman, I think those are the little things that made it difficult to then get to that final diagnosis. I had to then push and push and do my own research, and that was the only way that I think that helped me get to the finish line.
Being a Black woman, you were in the UK. I
Yes,
totally believe this could also be a reason. I totally believe it. Like,
of
I've
course.
been to doctors in Germany and they've taken me less seriously because I'm brown. How did your mom take it? Like, did she kind of go all out and be like, this is not normal, that she can't eat? Or what was her reaction like?
I think so. My mom actually had very painful periods as well, and I think for her it was just like also a case of maybe this is normal too. Um, for her, she realized once she started having kids that the pain sort of reduced a little bit. So she just also assumed that, okay, maybe that would also happen in my case. And in her time, I don't think anybody was thinking about endometriosis or thinking about hormonal imbalances. They were just getting on with life and just experiencing things as it happened. But it was very painful for her to have to hear me kind of groan in pain, or hear that I had to miss X amount of days off of school, or quitting certain jobs. You don't want to see your child go through what you sort of experience. And I have an older sister who didn't have this kind of pain as well. So it was kind of difficult. And I'm sure there were times where she sort of felt a bit helpless, because when you try everything and you try everything that they tell you to try, and you're just hoping that something is going to stick, that something is going to work. So there was a lot of questions, and I think a lot of helplessness as well, as to how do we fix this? Where do we go from here?
And how did the school take it? Did you ever have to come out and tell them what's going on? I mean, this is so painful.
Sure. My school teachers were fully aware of the times that I'd have to be off class, or have to kind of take time away. But I think, again, when you're not prepped for something, you just sort of wing it. And so there were times when there was a lot of dismissiveness, even from, say, female teachers, who I guess would assume, hey, this is a girl thing, like we all have painful periods, sort of thing. I remember in my late teens, I had a female GP who I was seeing at the time, and would often go back to about this pain, and they would try and prescribe the birth control pill to me as a solution for the pain. And as a teenager, I just thought, this isn't something that I think I should be considering or I should be taking. I'm not fully aware of all the potential side effects. There's got to be more. There's got to be an alternative. And I felt like in my sessions with her, it got to a point where, and she was a brown woman, and I remember feeling as though she was sort of diminishing my pain. She wasn't trying to dig a bit deeper. For her, it was just, this is another woman who's come in and is complaining about periods, and your periods are normal and period pain is normal. And so I specifically remember going back in and telling them, I want to change to a male GP. I think that in this case, I'm going to have someone who doesn't feel like just because they can relate my pain is not enough for them to pay attention to. And so I found that in doing that, here I was dealing with a man who was very honest about this is what I know, this is what I don't know. Let's see where we can go to get more answers. And it was such a shame for me that it took me doing that before getting the hospital referrals, um, before being able to, and even at that, getting the hospital referrals didn't necessarily mean I got my diagnosis. I ended up getting my diagnosis when I was in Nigeria during COVID. And that goes to show, again, I was in an environment where I'm surrounded by Black women and Black healthcare professionals who are really focused on the care of Black women, right? And so they're familiar with how certain things present themselves in Black women. So whether it's fibroids or endometriosis, and it was at that time where I heard the word endometriosis for like the second time. I think that just shows that, again, it takes extra conditions at times for Black and brown women, for us to get the answers that we're seeking.
First of all, I'm so sorry that this happened. You're not the first person to tell me that the system in the UK is just rotten to the core. And I wouldn't even say you're not the first person to complain, because this is not a complaint, this is a fact. Very often you find people from Pakistani and Indian backgrounds, and women have told me that, oh, we were pregnant and the doctors were not so understanding. My mom is a doctor. She's an anesthetist. She's not a gynecologist. But I always tell her that you could have been a bit more compassionate, maybe if you didn't work with gynecologists. Like, they're just one of the most, like, insensitive, cold people I've ever met in my life. Like, if you go for the condition to a doctor, they're just really dismissive and really reductive, because I feel like the fact that we did it and we're also women is like so central to the experience. It's a bit like projection.
Right. I survived it, so therefore you've got
You
to.
should too.
Yeah.
I completely understand. And I mean, it takes a lot. How old were you when you requested to get a male GP instead?
I was probably in college at the time. And so I would have been, say, 16, 17.
Very intelligent at that age. I mean, even if you couldn't fully articulate it at that time, you had a feeling
Yeah,
about it. And that
it
is,
just it became too much. You go back every month, and I was having pain before my period started, during my period, and after my period. The most intensive amount of pain that I went through was literally in the 7 days or so. So it just got very tiring that I'm having conversations with someone who is just ticking off a list and isn't really paying attention to the fact that I'm saying none of this is working. And if I'm telling you I'm passing out from pain, because it just gets to that point where my body physically just shuts down, I'm gonna need someone who is ready to advocate for me.
yeah, no, I completely understand. Who was the person? Was it a man or a woman who finally diagnosed it?
So, in my case, in 2020, between July and August, I realized that I had about 4 periods, which was very abnormal for me. Bear in mind, I say that my periods last on average about 7 days or so, and they were relatively regular. And in all my life, the schedule, the calendar always made sense, except in these 2 months. And so I started speaking to a few friends at the time, asking for recommendations on gynecologists. And I discovered that most of my friends were like, oh, I don't really have any specific person that I go to. And so I realized that a lot of women don't actually seek out this information until they get to a certain age, where maybe a certain reproductive season in their lives. And so I did a little bit of research. I discovered a female clinic called the Breast and Gynae Center in Lagos, Nigeria, and a specific doctor called Dr. Kemi De Silva Ibru, who essentially she's also British-Nigerian, had studied in the UK, but then spent the majority of her time working in Nigeria. And even at that time, I remember just kind of like Googling and trying to see if there were any other like reviews about her. And a few people had sort of tweeted about having a good experience with her. So I went in, I saw her, and she says, hey, let's just do a scan and take a look at what's happening inside. And that was my first time doing a transvaginal scan, or even knowing what a transvaginal scan was. Um,
What?
so we did an ultrasound, and then we also did a transvaginal scan. And I'd had like paps and smears and all of that stuff before, but never a TVS scan. So in the ultrasound, the radiologist had said he could see something, but he's not really sure. Let's do the TVS. And so in the TVS was when they realized that I had two ovarian cysts. So I had one on the right ovary, and the one on the left was a torsion cyst, which was twisted. And in that case, they were nervous about it because they didn't know what was inside it, and they didn't want it to get bigger and sort of like weigh things down and burst. So she had recommended that I go in for emergency surgery. So all of this happened within the space of like, I would say 2 weeks. So I then went to see the surgeon, who was, his name was Dr. John Ojoku from the AVLSE surgery. And he was like, yeah, we've got to take care of these cysts because we don't want them to rupture. So I go in for surgery that morning. And one thing that I remember with the gynecologist was she had taken me through a list of things. She says, we'll look for cysts, we'll look for fibroids, we'll look for polyps. And then the last thing she said on the list was endometriosis. I remember that clearly. So we go in for surgery. I wake up the morning after and I look under my gown, and I had these three what would I call them? Plasters. So two on my ovary, one on my stomach. We basically did a laparoscopic surgery where they go in with the instruments, and the surgeon doesn't actually put his hand in your body, but it's like a keyhole surgery. And so the instruments essentially just do the work, and he's looking at everything on the camera. And I just kept thinking, why do I have all of these little bandages? And so he comes in and he says, surgery was successful. We were able to take care of the cyst. However, we discovered that you have stage 3 endometriosis. And we immediately had to get to work, meaning that the adhesions had spread to my intestines and my diaphragm. And so they had to start zapping them in that moment what they could get. And the rest they were hoping to take care of with an implant that they had to put in while I was under. So this implant is called Zoladex, and it's basically an estrogen blocker. And what it does is it stops the body from producing estrogen, therefore no longer feeding the adhesions at the time. And so I was scheduled to be on that implant for another year and a half or so. So I'd have to keep going back for a top up. And
What does the implant do? Like, what does it
so
mean
the implant
in layman
basically,
terms?
yeah, so the implant basically stops your body from producing estrogen. It puts your body in an immediate state of menopause. And it comes with its own host of symptoms that I was not ready for. Remember, they just had to put this in immediately while I was under because of everything that they saw. So when he told me that, I immediately started crying. I started crying, thinking to myself, what did I do to create this situation? Which is such an odd thing to think about. To self-blame and say, I don't know, did I eat something? Was I exercising wrong? Is it just me? And from then on, my journey and treatment started. I suffered things like anxiety and had very depressive thoughts and lost my hair. At times, I remember being home actually from the hospital and literally seeing, my body, like certain rashes, in my chest that were side effects from the implant, or seeing how my body lost collagen in certain places, and just being really unprepared for that. I started just sharing my journey online as a way to sort of just cope, I guess, because I didn't want it to take another person 19 years to get an answer. But there was a huge sense of relief that, okay, I know what we're dealing with now.
This is a lot to take in, first of all, in a space of 2 weeks.
Mm-hmm.
It's hard to hear also. I can't, I'm super impressed that you went through this and you're openly talking about it. I don't have experience with something so severe, but like I saw a glimpse of something when I was really young, and it was a condition that was so blown out of proportion. Like, you get your period 3 weeks late. I mean, this is not a condition. This could be anything. This could be the weather. This could be stress.
Stress, yeah.
And nothing showed up on the scans and anything. But I feel like the whole construct about you're a woman and now this is happening in your body, especially in organs which are supposed to produce life
Hmm.
and where you're supposed to bleed from. And this is the ultimate, this is the culmination of having an ovaries to have a baby. And how dare you have a condition before which obstructs that process? I feel like that is so, it's so difficult to mentally go through that. You know, the fact that you said, I thought to myself, what have I done wrong? Or
Yeah.
like, this is, this is so difficult. And how did you process all of this?
I don't think I really did to begin with. I can be a bit of a delayed reactor at times. And I was just compartmentalizing and literally just said to myself, okay, what's the next thing? And I would give it to my gynecologist. She was really, really amazing in helping me emotionally. She would often tell me, you know, I know you're trying to cope by sharing as much information as you can and trying to see how your story can help other people. But I also need you to really, really remember that you are still in a state of healing yourself. So if you need a minute to just kind of like back away from everything that's happening, then go ahead and do that. And she just said, we're just going to take everything one step at a time. The first step was getting rid of the cyst, which has now led us to revealing that, okay, endometriosis is here. What's the next thing? How do we get you into a state where yes, we know that this is a chronic disease that there is quote unquote no um, cure for, but how do we get you into a state where you're able to sort of manage pain? I even remember because I was over medicating on painkillers. One pack was never enough on one particular period. I would probably go through 2 packs of your average basic period painkillers in a day. And so when I came out of surgery and the year and a half after, while I was on the implant, I wasn't obviously having my period. And when I first got my period back, I remember feeling kind of nervous about, oh my gosh, it's what's the pain going to be like? And thankfully for me, it was moderate, but there was still a little bit of pain. And so I was now scared of medicating. So I was now not taking pain relief because of the fear of getting back to that place where I was going through 2 packs a day. And so she had to sit me down and she said, "There's coping with pain and pain management are very different things. If you're in pain and you need to take something, take something. You know, don't be afraid of it because you feel like you're going to go over to that place where you were before. The kind of pain you're feeling now is very different to the kind of pain you were feeling before." So there was all of this like psychological warfare that was going into the entire thing. And I didn't really process it very well at the time.
No, this is so interesting you say that, because I feel like a lot of women are like that. I feel like we're very pain resistant in a lot of
Yeah.
ways.
And it's like, there's no trophy for
Yeah, and I don't know why we're
whoever
like that. Like
can stick it out.
like when I get my period, my partner tells me like, okay, so maybe you can take something, and I'm like, I don't need to. It's fine. I'm gonna take something before sleeping. I want to reserve that one
Yeah,
ibuprofen for bedtime.
I'll save it for later. Most of my gynecologists I've had great experiences with them. My surgeon was really great. And I think, again, they were just suitable to me, to how I receive information and communicated in a way that, you know, I found to be fair. They might not be suitable to another person, and they're really good at reading me. So over the years, they've sort of understood where my mind will go the moment I hear a piece of information. And then they'll sort of just talk me off the ledge as to, okay, let's go back and take everything in steps, because immediately my mind is like, oh my gosh, how am I going to eat everything on this plate? And they're like, no, let's just take it bite by bite.
Yeah. How does it work now? You live in the UK and they're in Nigeria, so
So I'm between the UK and Lagos, but I'm predominantly in the UK. And so when I'm in the UK, I have my GP, and so I even remember after I'd sort of finished my treatment, and my gynecologist in Lagos was like, okay, well, this is a great time for you to consider egg freezing, because if you want to look at fertility as being able to have children in the future, we've been able to sort of clear out as much as we can with the endometriosis. Let's look at freezing as an option. And when I was in the UK, I had tried to go down the route of seeing what my options were. And I remember with my GP, once they referred me to the hospital and they had taken a look at my case, I wasn't presented with an option to try out freezing on the NHS, because at the time, what I was told was something along the lines of, this is something that we're sort of targeting to women who have either had or experienced cancers, and so this is like their final point in being able to freeze their eggs and consider IVF. In my case, they hadn't recorded my endometriosis diagnosis. Even with everything that was on my record, it wasn't an option for me. So I had to consider going private.
What?
Yeah. It was very weird.
Can they
It
make
was.
that decision for you? Like, what if you still want to get it?
I didn't think about fighting it. I didn't, because bear in mind, this happened all through COVID. But they had my records, my years and years of the pain and coming back in, and here I was with all the files and all the information and telling them, hey, I've had to have the surgery. It was an emergency case and this is what we have. And so I then started considering the option of doing this privately. And I remember speaking to 3 different clinics, and they essentially refused to take my case. Most of the feedback was that they felt like my endometriosis case would sort of mean that the ability of me being able to freeze the amount of eggs that they would recommend or would like to have would be very low. And so they didn't want to essentially bother, because then this would also affect their success rate.
Wow. Oh my
Um,
God. Sounds like
I,
America right now.
I remember one of the clinics, the first time we had a conversation, a consultation, and then they were like, okay, we're going to actually have a meeting with some of our more executive practitioners about your case. And then I'll get back to you once we've had that meeting. And I just thought to myself, a bunch of people are going to sit on a call and discuss me and then decide whether or not I should be able to have this treatment, even though I'm considering having this treatment, paying for it out of pocket. And they came back to me and they said, yeah, unfortunately, the group had decided that my case wasn't going to be viable for them. And this is not a cheap thing to do privately. It's
I
very expensive.
know. Yeah, yeah, yeah.
Like, when I found out the cost on average of what it is to do a cycle at that time, you're looking at an average of 3,600 or 3,800 pounds for one cycle, and in that one cycle, you might not even get any eggs at all, and so they'd want to consider stimulating you again, and you
Again,
do another
yeah.
cycle or 3 cycles, and so that was a very sad time, a very awkward time for me, to just feeling like, oh my God, am I a failure in this sense? Because I've already been through one very traumatic experience to get here. And now I'm trying to move on. And here they are telling me again that this might not be an option for me. So what did I have to do? I then traveled back to Lagos. And again, I found someone, a clinic that was very reputable, and, gynecologist there who said, your case is hard, but I'm not going to tell you that your case is impossible. And that just removed a huge weight. And that's what I mean when I say I don't think I've had a negative experience with a gynecologist. This is at one wellness center in Lagos with Dr. Jean, who is he's a great gynecologist. They've set up this wonderful clinic that's in partnership with their Lebanese partners. And he was like, yeah, it's hard, but we're going to do our best to see what we can do. And so I ended up doing my first cycle with them. And that was an experience, all the injections, all the hormones,
Oh,
and
it's so horrible. A friend of mine
seeing
went through
how
it. Yeah.
seeing how your body changes, and just coping with all of that was just quite wild. I think for me, the difficult part was probably more so the emotional side effects, like just being intensely emotional for no reason. And so our first cycle, we were able to get some eggs, but then unfortunately they weren't viable enough to keep. And when he called me and was like, the nurse that called me and said, the doctor wants to speak to you. I said, oh yeah, sure, let's have a chat next week. She said, nope, he wants to speak to you as quickly as possible. And even when she said that, it still wasn't registering in my head. So he gets on the call with me and he says, I'm sorry to say, they weren't as good as I would love them to be for us to be able to keep them. And ultimately, I want us to keep them so that when it's time to use them, they're in the best condition possible. And, I'm crying over the phone and he's like, again, it's not impossible. We're just going to go again. And so we do it, go for a second round, have a successful round. And yeah, I was like, I wish I knew all of this in my early 30s. I would have done this.
Would you recommend somebody going through egg freezing?
Oh, for sure. If it's
Really?
if you want to think about the abilities and want to be a parent at some point, or want to be able to have kids and deliver them yourself, or at least just give yourself as many possible options, then I would most definitely say that for women in their, say, mid or late 20s, these are the kind of conversations that you should be having. If you're having a pap and spear and smear, sorry, to ensure that you're good cervically, or that you're watching out for any potential disruptors or cancers, then why not have certain tests to look at what your AMH is, which is your reproductive marker? Or why not consider freezing, just to give yourself that security blanket? Because I had surgery, the surgery had essentially sort of affected my reserve, because they had to obviously go in and poke around, and if my case wasn't an emergency case, the best thing for me to do would have been to actually freeze my eggs before having the surgery.
Wow.
But because we had to go in quickly,
Emergency, yeah.
yeah, we didn't have that choice. And so I say to women now, you should be doing these checkups
Wow.
quarterly. If you can save for a nice outfit, a pair of shoes, or hair and makeup, you should be budgeting for these health related concerns. It should be part of your monthly maintenance.
This brings me to this really important social cultural aspect. Like, I live in Germany now, you live in the UK, but I'm from Pakistan. And I feel like so many girls, so many women lose so many years of their lives because it's possible if you're married, then the conversation around
Will be happening.
sexuality, around your ovaries is more prominent, and it's an option. But if
Mm-hmm.
you're not married, you're considered like you're sexually inactive. First of all, that's the assumption. If you go to an OBGYN and you're not married, the possibilities are that you're going because you have a painful period or there is something else that needs fixing. It's you don't discuss your reproductive health unless you're married. Marriage should not be a barrier for that. Like, you're also your own person. What if you get married at a very later stage? Honestly, I don't blame the doctors sometimes, because I feel like they're also operating within a culture, because there are patients who get offended. So they're very cautious. So I had very excruciating stomachache, and I think this was just acidity or something.
Okay.
And it had nothing to do with reproductive organs, had nothing to do with period. And I remember it was Eid, and after 30 days of fasting, this is a very festive day where people eat a lot. And then I go to the emergency, and the woman, like, I think the nurse on call, and I don't blame her at all, like, I think this is also the environment she lives in. She was this young girl, and she took my history, and she asked me, are you married? Simply because my lower abdomen was in so much pain, my body was contracting, and I was just like not able to sit. And I was like, no. Like, I responded like really shocked. No. What does it have to do? I'm like, I'm dying. Can you give me something for pain? And I
Exactly.
was like, okay, this is such a huge stigma, you know? Like, I went to a doctor once in Pakistan. I told her my period is, I don't know, this was the same thing I mentioned. My period is like 1 week late. And the first question she asked me, are you in a relationship with a man? Do you have an illicit relationship? And I was like, is that like the only thing you need to rule out?
That's the cultural part. Yeah.
And I'm like, honestly, like, can we move past the shame and the guilt and then get to the problem solving? And I wonder, how is it in Nigeria? The fact that you told me, it's a bit of a juxtaposition, because in a lot of the global south, people think that healthcare would not be great, but in Pakistan, actually, healthcare is great. If you can pay for it,
Fantastic. Yeah.
if you can pay for it, it's great. But I mean, at the same time, there is this social aspect. What is it like in Nigeria? How open are these conversations? Is it taboo?
I think what I found was the moment I started sharing my story, it was a bit taboo because culturally, as Africans, we don't really talk about what's happening to our bodies or what's happening in our lives privately. You're not meant to, right? So you deal with those things and you sort of wait until you have the good news before you say anything. That's just the cultural aspect of things. But when it comes to women's health, I think in that environment where they're being faced with these issues in drones, right? You're dealing with a large number of women who do have fibroids, or who do have polyps or other reproductive related issues. It's common enough that I think there's a bit more sensitivities to it now. And of course, again, culture playing a big part. You will have a number of medical practitioners who will bear in mind the fact that a woman wants to be able to consider being able to have children in the future as part of the conversation that happens in the room when they are looking at you or when they are doing a test. But I think over time we've become a little bit more sensitive in the ways that as more and more people like us have the conversations publicly, it's sort of trickling down into the bedside manner. It's trickling down in the ways that certain professionals are handling women and the cases that they're bringing to them. At least in the earlier stages, there was a lot of misinformation culturally as well, where the thing that I heard the most from a lot of women was that they would have been told that, hey, once you start having children, the period pain will go away, or once you start having children, certain things, you won't have to deal with certain things anymore, which isn't always the case, but that's the cultural response in some cases. Things are changing. Like in the span of the last 4 years where I've been sharing my story, I've definitely noticed significant changes.
Is there any research to back it? Like, how does it stop hurting as
I'm
much?
sure I'm sure there is some research. There are some who believe that once a woman who has endometriosis gets say pregnant, it has the ability to reduce the level of pain and that she experiences after pregnancy, because in this case you have the body focusing its whole efforts on regenerating and a new life and the benefits and things that she's going to be able to absorb from that new life that she's creating, that the body can then sort of use. I think we should probably focus a lot more attention on really understanding, finding ways to sort of just address the symptoms and also addressing this quicker so that women don't have to be in pain for as long as they've had to be.
I saw on your social media, you do a lot of these fun series, and you always go in with a disclaimer a lot of times that you don't want to be the bearer of bad news. And I thought that was quirky. And I saw this series that you did, like, there's so many lies they've told us
Oh,
about
right.
our
There's so
body.
many random things about our bodies that we should know, but for whatever reason we don't.
Yeah. What are the top three lies that they've told us, you think?
Oh, that's a good one. So there was one that I did that basically showed an illustration of the reproductive system
Mm-hmm.
in a book
Yeah. I've seen that one.
versus
Yeah.
how it actually looks in the body. And when I saw that, I was blown away because I said, hold on a second, this is not what we got taught in school. there's no way this is what it looks like inside. And in the same breath, I was like, huh, this does now make a lot of sense, because when we are trying to identify pain and I'm saying I'm feeling a pain on the right side that's like coming through my back and all of that, like it makes sense. So that was a very like shocking fact to discover. Seeing how the egg comes out during ovulation, sorry, seeing how that happens, that was another thing that sort of blew my mind, because when you watch it you sort of see it burst out, and I was like, damn, I've definitely felt a pain that felt like a burst during my period, but how do I explain that to someone that it feels like something is bursting inside of me,
I
you
know.
know? Or there was another pain called Mitchell Shimmers, which is like feels like electric, like an electric kind of feeling, an electrical twinge in the body, which is again like the egg sort of making its journey out of the tube. I was like, huh. Here we go again. There's something else that I didn't know what it was called. I didn't know how it felt, but I knew I felt it, and I can now pinpoint what this is.
What do you think is one piece of information that's very underrated or ignored about female anatomy?
It would probably be the one that we kind of refer to at the beginning, which is the fact that pain is normal. It shouldn't be normal. But over the years, with be it the kind of food that we eat, or the hormonal factors, or the fact that, you know, some women have you've been on contraceptives, or environmental factors, these are the things that over the years have contributed to how women and the reproductive system has now consumed pain. Certain things about our bodies should not be painful, but they are.
Yeah, yeah. You know, I've always had this bone of contention with people who practice conventional medicine. I think partly because my mom's a doctor. So as a daughter, I was always like, yeah, you're just always like telling me all these mean things. Don't gain weight and don't do this and don't do that. And then I started doing seed cycling a few years ago for my period.
Okay.
I'm not sure whoever doesn't know, it's a process like where you basically eat a different set of seeds given your monthly cycle. So during ovulation, it's very easy, but I did it. And she was like, do you have any scientific evidence to like back this on? And I was like, I'm not sure there is a lot of evidence, but there's anecdotal evidence. And I mean, I'm just eating seeds. So what's the problem? She's like, yeah, I mean, they're good for your general health. And I was like, that is so dismissive, you know? And I feel like there is this whole thing, like there is this alternate medicine now, and it's
Mm-hmm.
very effective. I feel like doctors kind of downplay it. And I feel like for doctors, a lot of times, solutions are prescribing contraception. Like, this is also like if you have an irregular period, a lot of times gynecologists would prescribe you contraception, and then when you stop taking it, you get your period. I feel
Mm-hmm.
like that's a quick hack. What is your opinion on this?
Yeah, I have strong feelings about this. I was also offered contraception as a solution to the pain that I was experiencing with my periods and endometriosis. And it was, like you said, after maybe they'd offer harsher painkillers, it was the next stop thing. And I felt like it wasn't the right road for me, because I wanted to pinpoint what the issue was. I didn't want to just mask it or cover it with a cap and then have to deal with it once that cap is removed in the next couple of years when I stop taking contraception. And I think oftentimes, while yes, there are women who have great successful cases of having been on certain contraceptive solutions and, you know, found that their periods aren't as heavy or aren't as painful. For me personally, I just believe that it is extremely important for us to get to the root. And I think for young women, for teenagers, that oftentimes aren't fully educated as to what the side effects of hormonal therapy is like. I think it's not fair to just push that without the education, without presenting them with options. I mean, there you also have like cases where women have had terrible experiences with certain contraceptive solutions that have led to more pain or heavier periods. Because if that issue is still going to be there when she's off the period, then the job is not done.
You know, you said that a lot of young girls are not properly educated about reproductive health and their own bodies. So, how do you think young girls should be taught about their anatomy in a way that's simple but it sticks with them?
I think media is extremely powerful. And being an actress, for me, the power of film in being able to convey certain messages and information is definitely a sure way to do that. And after my experience, I realized that this was the best route for me to go down, which is why I started developing the short film that I'm currently working on right now, titled Blood, which is a psychological thriller that sheds light on the horrors that women experience with endometriosis and women's health. And I partnered up with an amazing team of people to be able to do that, being Okurens, the production company based out here in the UK in Paris, CSA Global, and also an amazing director and writer called Talia Smith. And we chose this route because we know just how easy people sort of assimilate information from media. We're on our phones all the time. So we're constantly, in front of the television. Like, what better way to convey a message and teach people how these conditions sort of affect women in an entertaining but also very powerful and educative way. I know that there's great benefits to having certain sort of conversations within the school system. Like I said, in my case, I was in primary school and I first had my first sex education workshop that introduced me to period management and pain management. And I will never ever forget it, because if I didn't have that, I feel as though I wouldn't have been as prepared. I also think it's extremely important for parents to build communities and have conversations with their children a lot earlier. I know that it can be a bit uncomfortable, to want to have these conversations, but you don't want your children finding out certain things from their peers. Like, you want to give them as much ammunition and as much preparation as they step out into the world, and also like just creating an environment where they can have certain types of conversations with you. Even in the workspace, like, I had lost so many jobs because I wasn't able to be steady. I did a lot of retail when I was younger. I loved it, but say there was an environment whereby there was a room where I could literally just go in and lay in for like an hour to just kind of bring the pain down and or sleep the pain off. That might have been helpful to me in being able to hold on to a specific gig. If there are certain rooms like that in secondary schools or primary schools, that girls can take a time out to, again, just process and deal and talk therapy before they go back to class, and also desensitizing what's happening. Like, there's nothing wrong with the girl that's crouching over in pain. She's not crazy, but how do we also teach other people to help her and help her manage that pain? So it's a everybody issue, I say.
So it's really interesting because you already brought that up, and I was going to bring it to how it affected your life in general. Like, you're an actor, you've been acting for 15 years, you said. And this is very demanding. Like, when you're filming and when you're shooting, it's just like if you're in the middle of a project, you have no breaks. How did this condition affect your overall life? Your relationships with people, your dating life, perhaps your friendships,
Yeah.
as well as your
um
work.
I think for the longest time, not knowing what the issue was, I didn't realize how it was affecting every aspect of my life. In my earlier teens, I remember having to miss out birthdays or social gatherings, or getting dressed to. I remember my cousin's birthday specifically. She was having a picnic in the park, and I was getting dressed and ready, to have a great time. And then, the pain comes in, and I wasn't able to go. And I remember just spending time, the only place I could get comfort was literally in the bathroom, laying down on the tiles, because the tiles were cold, and for some reason that I just felt a little bit of comfort doing that. And so there were moments that I missed out on. There were community events that I couldn't be a part of that I knew that certain people took personal because, you know, they probably just felt, oh, she's always canceling last minute, or oh, she's always blaming her periods or whatever. And I felt helpless because I couldn't. How do you explain to someone something that's unseen? How do you explain the pain that you're going through? Especially when you have other people saying, oh, I don't really have pain like that, or my pain only lasts for one day, or I just take a paracetamol and I'm fine. There were lots of jobs that I had to quit that, you know, I'd start on a Monday and then by Thursday, I'm like, I don't think I can sustain this because, like, surely they're going to get tired of me calling in and saying, oh, I'm having pain. And then you then have to find like excuses because telling someone that, oh, I can't come to work because I have period pain sounds kind of amateurish, like weirdly in my mind at the time. Because again, people just treat period related pain as like a common
Yeah, it's
headache or
business as
cold.
usual.
Like, it's really not that. If I'm telling you that I'm crouched over, I'm bending, or I'm having to crawl, or, you know, I passed out in on the floor, it would be hard because there'd be times that I could, like, if I watch back certain things, I can tell you when I was in pain in the middle of a scene, or when I've just sort of like disassociated in that moment, or just kind of isolated myself. I would isolate a lot because I just had to create an environment to get through the pain. So I had little things that I would do, whether it's lying on a cold tile floor, or groaning or grinding my teeth. Like, the sound would sort of help a little bit within the pain management process. Like I mentioned, taking several painkillers that definitely weren't, I shouldn't have been taking them as often as I was taking them, or in those numbers, but it was the only way to at least be able to function to a certain extent. Again, there was no one that I was able to explain that to. Who am I going to start
Right.
explaining that to in production, or
Yeah.
that would be sympathetic enough to be like, you know, we get you, we understand if you need a day off set, you can have it. Everybody's, most of the time, they're thinking about themselves and their projects and the money that's been pumped into here, and so parts of me felt guilty that, damn it, I can't tell them that I need this day off. I can't
Yeah,
afford
yeah, yeah,
it.
yeah.
I have to show up.
Do you think people's reactions changed at all after you got diagnosed and you opened up?
In my community, like especially online, it was so rewarding after sharing, because I had hundreds and hundreds and hundreds of messages from women who were like, oh my gosh, like, I feel seen, or I've experienced this, or I know someone that's experienced this, or I had dads who said, I have a teenage daughter that I felt so helpless. I didn't know how to help her, but it sort of helped me understand her just a little bit more. In terms of my workspace, like the film space, I don't, you know, there were obviously individuals that, again, are a part of my online community that sympathized, but I don't think there was a lot of reproach in, say, how to then handle me or my case, or justifications for things. I think I had to just make certain decisions and put certain things in place for myself. You know, I didn't think there was going to be a safe space in a particular production for the down times that I'm going to need, then I would walk away from it. Or if I felt like somebody wasn't going to understand the fact that I have new dietary requirements now, that maybe don't fit into the budget, then what are my options? Do I sort this out myself, or do we, do we walk away from this, or do we compromise? Like, I had to make a lot of hard decisions myself that probably would have oftentimes appeared quite selfish, but I think I spent so many years not being selfish.
It's absolutely not selfish. Like, I just think that it's not selfish. Like, you gotta do what you gotta do. You're not
You
gonna.
gotta do what you gotta do. So I finally got to a point where I was like, you know what? Anybody that gets it, and everybody that doesn't.
I'm not saying it's not true for the opposite gender, but I mean, I'm a woman, so I can speak about women because I know more about women's issues, and I know that we obviously goes through a lot more with our bodies. Even if you like have no traumas, I mean, I don't know a single woman who has no traumas, but let's say someone has had a fairly smooth ride, she would also have like something to deal with. And I think what we
Hmm.
really underestimate is like the emotional toll it takes on the body.
Oh
Like,
yeah,
I
for sure.
think, and the mind. And I feel like at workplace you keep up this front where you have to function, but I feel like
Hmm.
it's so grossly underestimated that if I go to sleep with a condition, the next morning I have to go to work, or I have to work, whatever your workspace physically looks like, you just have to function, and that's switching on and off. It's very demanding. Like, it's
It
not
is.
easy, and there is no time that's accounted to be like, okay, well, this is my time to heal emotionally. Well, you have to do this on your vacation, basically, because there is no time. And I feel like there's not enough rights as a woman, if you are working, or like health based rights, that, well, this is part of healing. I mean, okay, Germany is really great in that way. It's actually really, really great. But I mean, it's also like, how much time can you actually realistically take off? And I feel
Mm.
like that conversation just never happens, so it doesn't occur to people that this is an option. And I feel like a lot of times what I've noticed is a lot of people, and I'm not saying this about anyone in specific, a lot of people, a lot of bosses, a lot of seniors are very conducive to, okay, well, if you have a condition, we understand that, but it just makes you less valuable as an
Mm.
employee.
I mean, I know some conversations where people are like, hey, I think certain reproductive issues should be classified as disabilities. They are unseen disabilities that oftentimes don't get the attention or respect that they need. So I completely agree with you that it would be great for us to have a bit more consideration in the way the world or the workspace deals with these issues with
Yeah.
us.
So, one thing I think what we grossly underestimate, and it's not normalized, is the fact that when you have your period, and even if it's a regular period, you can be blood stained, or you can leak, right? Like
Mm-hmm.
if you're wearing a tampon or if you're wearing a pad. And I feel like there's so much stigma around period blood, or if you're leaving a stain on the bed sheet, or especially the culture I come from. Like, this
Mm-hmm.
was a huge deal. Like, how the hell did you wake up and not notice that there was blood on your bed sheet? And this is the first time in my life, actually, over the last few years that I've lived alone, and now I live with my partner. When I was a child, this was such a huge conversation that I just never really cared enough to check after waking up, checking, okay, well, the bed sheets stain or whatever. And I feel like this could happen in a social setting, this could happen in a public setting. I remember being in school, and the school uniform was white. So if you
Ooh.
have a stain on it, it's just so obvious. And I feel like there was very little consideration. It was very shameful. What really alarms me is that period blood, okay, well, it's very painful. In your case, extraordinarily painful. But I feel this is the only kind of blood that's not being spilled. This is your body producing blood, and I feel like we're so comfortable seeing all these images of like children dying and bodies mutilated on the media, and nobody has I mean, obviously people are traumatized. I'm not saying that this doesn't affect people, but I feel like it's so normal to broadcast that,
Mm.
and it's so taboo. Oh, well, you have a stain on your clothes. Like, this is the only blood which is like a natural consequence of having an ovary.
Mm-hmm.
I'm like, why are you making it look like it's so taboo? This is the only blood that's not being spilled. Like, nobody is killing me and nobody's spilling blood. It's just how it happens. And have you ever, like, of course, you went through this big condition. Did you feel like this was a consideration? Like, being in public, how would it react?
Yeah. I mean, I would regularly have stains. I would regularly wake up with stains in the bed, in bed sheets, and this is with somebody who is using.
And have you ever, like, of course, you went through this big condition. Did you feel like this was a consideration? Like, being in public, how would it react?
Yeah. I mean, I would regularly have stains. I would regularly wake up with stains in the bed, in bed sheets, and this is with somebody who is using a tampon and a pad at the same time, because that's just how heavy the flow was. I would have stains and accidents in school, and you quickly, the moment one of your girlfriends says, "Oh my gosh, you're stained," you grab your school jumper, you tie it around your waist, and you run to the
Mm-hmm.
bathroom to quickly try and wash it off. Even on certain red carpets where I've had like accidents, right? And you're right in the sense that there's a dirty hidden association with period blood. Um, Even when I was younger, like people were kind of nervous about even saying the word period for some reason, like around boys, or saying, "Oh my gosh, I
Yeah.
spent a period today." Like that sense of, oh, everybody's going to be uncomfortable if you talk about it.
Even in the
And
UK?
even in the UK. And I just thought it was the most dumbest thing, because this is something that I didn't choose as a woman. This is a natural occurrence. How can that make you feel eerie and uncomfortable? Um, I have to deal with this privately, and I do my best to deal with it privately to ensure that, yes, I'm not staining everywhere I go, or I'm not spilling everywhere that I go. We do our best in making that happen. The least you guys can do is not be uncomfortable when we are having conversations and we are expressing how painful it is or how it affects us. Or it brings me joy when I go into a bathroom and I see like tampons and, sanitary pads in certain offices that are in unisex bathrooms. And I'm like, hey, this is very considerate. Like, why should we have to hide? Who decided that this should be
This is
hidden
dirty. Yeah.
and
Who
dirty and
decided that this is
disgusting?
something I have to
Who
be
decided that?
embarrassed?
Yeah.
Yeah,
And
no, I
so,
completely get it. Like now I wake up and I mean, moving away from family does these things where you just realize, well, if there is a stain on my bedsheet, I have a washing machine and I can wash it.
yeah,
Like it's that simple. Why should I think less of me? Oh, it was so irresponsible of me. Now it's been
yeah,
15 years I'm getting my period, but I still don't know how to wear a pad, or I don't know. I still don't know how to administer a tampon. Like I must be so stupid. I don't know how to do it. I feel like this was so
it's so ridiculous.
unnecessary. It was so unnecessary, and the amount of energy it takes, like kind of like self sabotage that
Yeah,
comes with it. Like I should have known better. I feel like all of these things just makes girls and young girls just so traumatized. Nobody likes to wake up at like four o'clock in the morning, right, to manage bed sheet stains, right? So you usually wake up before it's time to go to work, and then you're like, oh my god, if I leave this unclean, I'm gonna get so much backlash for it. Let me just quickly wash it. And I feel like this is a societal, cultural thing, and the energy that we spend on this.
mm-hmm,
Yeah.
completely.
And now about blood. So you're doing a film. This is really exciting
Yeah,
about this. That's the thing that stuck out for me the most. Like it's advertised as a
yeah.
psychological thriller. Why is that intentional?
Yes, very intentional. Because the essence of the project is to sort of mimic the symptoms and conditions and the lived experiences of these conditions. You do feel like you're going crazy as women who experience these painful conditions. You do feel like, because it's unseen, you can't possibly be feeling like you're dying. And we noticed that when we're still fundraising for the project, and which for me, that's been very interesting as well, because everybody loves the idea of something that's commercial, that's fun, that's laughable, or that just makes you disappear into a world. But when you talk about social impact projects that most importantly affect women, you do get a lot of brands and people who are like, hey, this sounds great, this sounds like a fantastic cause, we support it. But then when it's time to put the money where the mouth is, it's not, that doesn't quite transcend. And we're talking about something that again isn't a sexy subject. Even in the title of the project, blood, like as you've rightly said, it's considered a dirty word, right? That isn't, or an unclean word. So you find yourself trying to just paint this picture of this piece that is going to be art, that is going to be cinematically powerful, because what we want is, we want people leaving the screening feeling what these women feel. We want it to be incredibly interactive because for me, over the years, the difficult thing was that I felt was, how do I get someone to understand what I'm feeling? And the only way I can do that is by making them uncomfortable. And so that's what this is. And we're just really hoping that we get more and more support. And in this year, we've done extremely well, even with our crowdfunding, where we got so much support from individuals who are very connected to the story. Blood for Me was born, sorry, not only just out of my own personal experiences in life, but particularly one strong story that I read of a young woman in Nigeria who was a virgin and the breadwinner of her family, who often had really tough periods and pain that prevented her from working at times. And she had gone to so many different places, had gone to see a community doctor and a herbalist. She was, not from an extremely well-to-do family or economic background, and so she goes to someone who tells her that the best way for her to get rid of this pain is to start having children and start having sex.
Oh God.
And he offers himself to her, and she does indeed get pregnant. And that's her life changed in that moment. That's her family's life changed in that moment. And everything becomes different. And so when I heard her story, not only was I shocked, but also in pain, because I felt like she wasn't able to advocate for herself. She didn't find herself in a safe environment with someone who was educated enough to even look at all the other possibilities. There was just too much misinformation. Her issue could have been anything from stress or a hormonal imbalance, or it didn't have to get to that. And for her to feel like this was the solution, or to find herself in a situation where she was manipulated into feeling like this was a solution, was very sad for me. And so we want to use the film as a vehicle to trigger advocacy and workshop and educate young women on the continent of Africa and also globally, and really teaching them how to advocate for themselves. You will look like a very annoying person. You will look like the person that sounds a little bit crazy, who comes into every healthcare appointment with a file of all their tests and everything. Like, you will be gaslit. But the work just doesn't stop. You
Yeah.
just have to keep going.
I think you shared the story with me when we had our first call, and I
Yeah.
was shocked. Like, I was like, wow. And I mean, I'm shocked, but I wasn't surprised because I've heard so many cases like these, and this is extremely, extremely abusive
Yeah, and danger.
and very dangerous. The next thing that comes to my mind is that, you're a woman of color. I'm a woman of color, and I know that there's a lot that goes on in the global south, in Pakistan, in Nigeria, a lot of countries in the world, which is less than ideal. Like, there's a lot of abuse, and these are all genuine stories. But what I wonder is that, how's the film gonna do like justice to this, in that it would tell the stories, but it doesn't like tokenize women and kind of dehumanize people from Nigeria. I think this is a really fine balance, that you want to tell a story, but you don't want to make it look like, well, in this part of the world, this is happening, because I'm pretty sure in the UK also this is happening. It's just
Yeah.
we don't know enough cases, or
So,
maybe we do, right? Is this a consideration that's crossed your mind?
what we've done with the storytelling and the script is to strictly focus on the character's experience from a social, economical, mental, and physical standpoint. So we're not pointing fingers at anyone. We are literally shining a light on what a day in the life of this person actually looks like. You do get to see how isolating it is for them. You do get to see how they have to constantly reorder their life and their plans and aspirations in light of this disease and condition. You do see how, at the end of the day, they're left with just getting on with it, because that's the that's the reality of society. And so our hope is that by literally seeing how everything plays out for the character, that it is stirring up conversation in individuals, whether, within the legislative or within the healthcare practitioners and community. It is stimulating a conversation whereby you're having to ask yourself, what role did I play in this without actually seeing myself? What role did the GP play in this without her having to go to the doctor? Because you see a woman who is even nervous about going to the doctor because what is she going to meet when she gets there? What sort of conversations and solutions is she going to find? So she stays at home and manages the pain and tries to figure it out. So there isn't there is no finger pointing. It's just stimulating inner introspective conversations.
Are you excited for the film to come
I
out?
am really excited. It's been such a long journey, and like I said, it's tough, raising funding for something like this that isn't super sexy, but is extremely close to home for me. And so we are working at approaching brands and having conversations with corporations that are that have a CSR target and focus towards women. We're trying to get as creative as possible as to how we can continue to raise funding. But it's a community effort. We need the support. We need more and more people to say, I have a woman in my life in one way or another. And so how do I commit to this project? How do I support this project? And every little bit counts for us. We have such big ideas and especially for our screenings and what we want to be able to do with it. So yeah, definitely just hopeful for more conversations that help us reach our goal.
Nice. And after this whole experience and journey, you've also survived so many years of treatment and everything. Did you develop a ritual or something that helps you cope emotionally?
I think therapy was a great help. Also just slowing down when I need to slow down and not being afraid of what happens when I do slow down, or even if it creates a little bit of chaos. So, and trying to be kinder to myself. Yeah, as women, we don't do that enough. There's often a little bit of guilt that comes with taking time. So, yeah, I would say those, and also spiritually for me as well. I'm a Christian, and my faith has been a huge part of really helping me through that process. So, those are the three things that have helped.
I also meant like something, like I don't know, some a morning ritual. I need to do this 40 minutes a day, or like I need to walk in this way, something like this,
Mm,
something more.
oof. Those things that I've mentioned are part of if you want to call it a ritual, part of the exercise. So if I'm lifting my spirits because I'm listening to a sermon, then that's done it for me. Or if I'm, able to make it to the gym today and I don't make it tomorrow, then there's the forgiveness on that part. So yeah, just a gentler way of living life and existing.
That's an asset. The skill is an asset. This is almost not a skill. This is an asset. The forgiveness part. So I think that is true.
Yeah.
Well, thank you so much for speaking with me.
Thank you.